to cover laboring in the hospital and your hospital stay during COVID-19. Many of you might be wondering, what are the hospital policies and guidelines related to COVID-19? I wish I could tell you that there was one solid guideline out there. However, each and every hospital and every city and every state, every country might be different. For example, one of my friends in Japan wasn't even able to attend his son's birth in the hospital just because he was not allowed in. And then on the other hand, my hospital allows one support person and a certified doula if you choose to have one. So just to be safe, ask your primary healthcare provider regarding COVID-19 information or check out the hospital's website ahead of time. Next, I will list some general recommendations that I believe most hospitals will include. Everyone going to the hospital should have and bring their own personal face mask. When and how often to use will depend on your hospital policy. If your support person has COVID or flu-like symptoms, please tell them to stay home. Healthcare providers will be wearing protective personal equipment, also known as PPE, wearing their face masks as a minimum, and they may supplement them with gloves and goggles and gowns. If you have suspected or confirmed COVID-19, you and your support person, if they are a household member, will be put on isolation. And being put on isolation means being put on contact and droplet precautions, meaning you will be in your room, in your laboring room with no in or out privileges, as well as the medical staff will wear the appropriate PPE. In most hospitals, there are no visitors allowed at this time. COVID testing protocols and eligibility are dependent on where you live. For example, at my hospital, if you have a fever that reaches 38 degrees Celsius, you will have to do that uncomfortable nasopharyngeal swab, and results should come within 2 days. And just so you know, women who have suspected or confirmed COVID-19 do not automatically get a C-section. A C-section only occurs if medically indicated. If you do have COVID-19, you should be able to safely breastfeed your baby as long as you have good respiratory hygiene and wear a mask. You could also hold them skin to skin, and you can room in with them as long as your baby doesn't need to be admitted to a different unit. Next, I will go over some examples of questions that you should think about and find out prior to your stay. Who can I bring as a support person? How many support personnel can accompany me to the hospital? What is the policy on face masks in public spaces or in a patient care room? Can I bring personal equipment such as my own pillow or blankets or other things that are needed for labor? What are the pain relief options available to me, especially the use of Entonox gas? Or some housekeeping things like, will I be able to access drinking water, the kettle, microwaves, or the fridge? Here are some friendly, gentle reminders to keep in mind while staying in the hospital. Please wash your hands frequently with alcohol-based hand sanitizer or soap and water. Keep at least 2 meters distance between others and avoid crowded spaces. Wear a non-medical fabric face mask where indicated. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene, such as coughing into your elbow or coughing into a tissue and throwing away, but not like that. If you have a cough, fever, or difficulty breathing, please seek medical care early. Call into your healthcare facility and follow their directions on what to do next. Other than the slight practice protocols that I have already mentioned, rest assured that all pregnant women and their newborns, even if you have confirmed or suspected COVID-19, have the right to high-quality care before, during, and after childbirth. As a medical profession, our goal is to provide safe and positive childbirth experiences, so feel free to ask questions often and let us know how we can make your experiences better. As with everything these days, policies and guidelines are constantly changing just because of the nature of this virus. So please be patient and understanding if things aren't exactly as how you expected. And again, please refer to your primary healthcare provider as your first source of information to follow. I hope I tackled some of those questions that might be on your mind regarding COVID-19 and your hospital stay. Please feel free to comment below on any additional questions you might have. Thank you so much for watching. Don't forget to like, comment, subscribe. This is Matt Nurse Nat signing out from Heart to Cheek. See you next week.